the body of the mandible is gradually developing, especially behind the molar area, deciduous molar area. Deciduous first molar is here by this time. Second molar will come at the age of 24 months or 2 years. But at the age of the second deciduous molar is also there because it is 3 years. So behind the second deciduous molar, we need more space for the development of the first permanent molar. First permanent molar will come at the age of 6 years, but it starts its development at the age of 3 years. So at the age of 3 years, there must be some room for the first permanent molar. So gradually the mandible is growing behind the second deciduous molar in the retromolar area. This is known as retromolar area. Increases in height by the growth of the alveolar process accompany the eruption of all the deciduous tooth, the bone and disposition at the lower border of the mandible. So height is increased. How? Because the deciduous tooth are in position, so alveolar ridge developed. Due to the development of the alveolar ridge, the height of the mandible has increased already. Secondly, there is continuous deposition of bone at the lower border of the mandible. So mandible is also growing in the lower border also. At the same time, mandible is increasing, having growth in height and having growth in length also. At the same time, the thickness of the mandibular bone is also increasing. So buccal side, there is deposition of further bone, and in the lingual side also there is deposition of bone. So in all direction, the mandible is growing up. Not only the mandible, actually, we are discussing about the mandible, but actually maxilla and other bones of the body all are growing and developing at this stage. So in the mandible, there is a three-dimensional development. The ramus of the mandible at the age of 3 years old, what is happening? The condyle is at a lower level than the coronal process. Still, the coronal process is at the higher level. The sigmoid notch becomes a little bit deeper because both the coronal and the condylar process had little development. So as a result, the notch becomes a little bit more deep. The mental foramen is below the socket of the D. Now the tooth has been developed. Deciduous tooth is in place. So A, B, C, D, E, all 5 teeth are present. And we'll find that the mental foramen is related with the socket of the lower D. And the mandibular angle becomes 140 degree. Actually, it was 170 degree during birth. At the age of 3 years, become 140 degree. At the age of 6 years, it will become 120 degree. And the minimum angulation is about 110 to 120 degree. At that time, you will find that the condylar process is higher than the coronoid process because it is uplifted. It becomes straight and uplifted. So what will happen? The condylar head will be in the higher line with the in comparison to the coronal process. But finally, at the age of old age, what will happen? Again, this mandibular angle will become obtuse and it will become more increased up to about 170 degree. As a result, the condylar head will go below the coronoid head. At the age of 6 years, mixed dentition period. We have A, B, C, D, E. Additionally, we have first permanent molar also at this time. So we will see the situation at this time. The mixed dentition period started to occur by the eruption of the first mandibular permanent molar at the age of 6 years. The mandibular angle is about 120 degree. Now the mandibular angle is about 120 degree. Mental foramen opens nearly midway between the upper and the lower border of the mandibular body. Okay, because in the early age, the mental foramen was near to the lower border, but now the mandible has developed from the upper border with the alveolar process, and also from the lower border, it has developed a lot with addition of further bone. So now what is happening? The mental foramen did not change its position, but because the two border has increased, now the mental foramen is in the middle of the mandibular height. In the middle of the mandibular height, it is maintaining the same situation under the socket of the lower D. But remember one thing, because the mandible is growing day by day, mental foramen finally will stop between the lower 4 and lower 5. Mandibular canal is situated little above the mylohyoid line. Mylohyoid line is present on the lingual side of the mandible, or inside the mandibular surface, lingual side. So it is a ridge actually. It is a ridge. You know the ridge. It is an elevated area, elongated elevated area is known as the ridge. So mandibular canal is situated above the mylohyoid line. This mylohyoid line is a ridge, and mylohyoid line give attachment to the mylohyoid muscle. So this mandibular canal is situated little above the mylohyoid line. Mandibular canal is inside the bone, so you cannot see it from outside, but with the help of the mylohyoid line, position of the mylohyoid line, you can understand the position of the mandible now. Mandible at adult age, when he is adult, the baby is adult means after the age of 18. The appearance of the mental protuberance, which gives the characteristic chin appearance of the adult. Now, by this time, the chin has been developed. You see, this is the chin area. This was separated at the age of 1 year. At the age of 1 year, it has been the two halves has been united, and now the continuous growth of the mandibular bone makes a chin here. This chin is a male characteristic. You will not find chin in the adolescent. I mean, at the age of 3, 4, 5, 6, 7, 8 years, you will not find the chin. But at the adult age, you will find there is a nice chin. The mandible increases in length and height due to the eruption of the permanent tooth and growth of their alveolar process. Okay. So the mandible has developed in its full, in the height, in the length, and in the thickness. In all ways, the mandible has been developed nicely, bearing all the tooth on the alveolar process. 1, 2, 3, 4, 5, 6, 7, 8. All 8 tooth is present maybe in one quadrant. If the lower 8 is impacted, then you will find 7 tooth in each quadrant. The condyle present at a higher level than the coronary process. You see now, finally, the condylar head becomes higher position than the coronary process. And you see the angle of the mandible is now about 110 to 120 degree. The sigmoid notch becomes deeper because due to the full development of the condylar head and the coronary process, both the process has been developed so much that the notch become deeper now. The mandibular angle becomes 110 to 120 degree now. This is the maximum uplift position. The mandibular canal runs parallel to the mylohyoid line, midway between the upper and the lower border. So remember, mandibular canal is always related with the mylohyoid line. It is running parallel to the mylohyoid line, but now the canal is in the midline of mandibular height. Mandible has been developed in height, in depth, and in width. But now the mandibular canal is running just at the middle of the mandible, at the middle of the body. Remember, at the age of early age, because there will be one question from these slides. The old age, we told you that the mandibular canal is running near the lower border of the mandible. Remember, mandibular canal is always related with the mylohyoid line, but the lower border is now nearer to the mylohyoid line because mandibular canal is small in height. Gradually, there is development of the mandible in the lower border, in the upper border. Upper border is due to development of the alveolar process, lower border due to continuous deposition of the bone. So at the adult, what is happening? The mandibular canal it's in same position, but it is in the same distance from the upper border and from the lower border. So it is in the middle of the upper and lower border. Finally, at the old age, what will happen? All the tooth will go and the alveolar process will be destroyed, because if there is no tooth, there is no socket, there is no alveolar process. So if the alveolar process goes down, the mandibular canal is in same position. The lower border it's in same position, but the upper border has lost its position due to the loss of the alveolar bone, and the upper border is now nearer to the mandibular canal, or you can say the mandibular canal is now nearer to the upper border. So the situation has been changed. You see the scenario. At the early age, during the birth, the mandibular canal was nearer to the lower border of the mandible. At the middle age, adult time, the mandibular canal is running between the just center of the upper and the lower border, and finally at the last age, the mandibular canal is running nearer to the upper border. So situation has been changed. The mental foramen is present below the socket of lower 5 and lower D. Actually, it is in between the socket of the lower 4 and lower 5. Okay, because why? It was under the lower 4, I mean D. But gradually the mandible has been developed, elongated on the on the horizontal dimension. So the mental foramen has shifted its position towards the 5. It becomes between the socket of the lower 4 and lower 5. Okay. So any question until this? Any question? Anybody? This is a very small lecture. We have few 5 or 6 slides maybe. No question? Sure.
No.
Okay. Mandible in the old age. Edentulous mandible. Old age actually we mean what is old age? 50 is old age, 60 is old age, 70 is old age, 80 is old age. But we are actually describing the condition when all the tooth is lost. When the tooth is being preserved, there is little change in the mandibular height. But of course, the angle of the mandible will be changed with the time of age. But when it is edentulous, there is a gross change in the mandibular morphology. That is our interest in this lecture. Following the loss of teeth, the mandible is reduced in size due to resorption of the alveolar bone. I told you that there was tooth. There was tooth here in this area. There was tooth, but this tooth has been has gone away. So alveolar process also gone away. The individual tries to bring the upper and the lower jaws near to each other during mastication. Even the tooth is not there, it is our normal tendency that when we will take food, we will try to masticate the food with our gums. So every individual, he tries to chew the food particularly with his gums and try to clinch more tightly so that the gums of the maxilla and the gums of the mandible can come together. Okay, this is a normal tendency. The condyle is more or less bent backward till it becomes a lower level than the coronal process. You see, the mandibular angle is becomes 140 degree. As a result, the condylar head becomes lower than the coronal process. Okay, again, the coronal process is in the upper level of the than the condylar process. The sigmoid notch is shallower than the adult. Because why? Because the mandibular angle is B, the coronal process become laid down, flat down behind, and as a result, the sigmoid notch becomes shallow. The mandibular canal and the mental foramen are now close to the upper border of the body of the mandible. This situation has been changed. Actually, from the from the mandibular canal to the lower border is in the same position. But the upper border, due to the loss of alveolar process, the upper border has shifted to the midline. So now the mandibular canal is nearer to the upper border of the mandible, or upper border of the mandible is nearer to the mandibular canal or mylohyoid line. The ramus is oblique in direction with increasing in the mandibular angle. The ramus is now oblique and becomes 140 degree. So this is the situation at birth. You see 170 degree mandibular angle, and the condylar head is below the coronal process. The mental foramen is near to the upper border. There is two halves. There is no connection between the two halves of the mandible. Now at the age of 3 years, this is 1, 2, 3, 4, is A, B, C, D, E, develop 140 degree. Still the coronal head is below the coronal process. Coronal head is below the coronal process. At the age of 6 years, what is happening? A, B, C, D, E, additionally there is 6. The coronal and condylar head, still the coronal is in upper, mandibular angle has been changed. The situation is giving uplifting. The adult age 1, 2, 3, 4, 5, 6, 7 is there from the age of 18 until the age of 18. From the age of 18, there may be 8. Okay, so 1, 2, 3, 4, 5, 6, 7, 8 tooth may be there. The angle of the mandible has been reduced to 110 to 120 degree. So the ramus has been uplifted straight, and now the condylar head is above the coronoid process. And at the age of old age, again the situation has been changed. The mental foramen is near the upper border of the mandible. Why? Because due to the loss of the tooth, the alveolar process has been lost. Okay, the angle of the mandible is again becomes bigger. This is 140 degree or a little bit more. So as a result, what has happened? The coronary process is again above the condylar head. So the situation of the old age and situation of the at birth is becoming similar almost. So this was the uh, lecture about the time different mandible at different ages. Actually, what we want to know the with the course of time, what was the position of the mental foramen? It is nearer to the D, nearer to the upper border, nearer to the lower border. In which age, in which position? The mandibular canal, nearer to the lower border during the birth, in the middle during adult, nearer to the upper border at the age of old age. Why? Due to loss of alveolar process, due to loss of tooth. The angle of the mandible at the depth, at the early age, it was at birth 170 degree, then become 140 degree, then become 110 to 20 degree in the adult. And when it is 110 to 20 degree, the condylar head is above the coronoid head. But again, in the old age, it becomes 140 degree. So what is happening? Again, condylar head became lower than the coronal process. And finally, the what? The sigmoid notch. Sigmoid notch was shallow in the early age, becomes deep in the adult age, and again becomes shallow in the uh, elderly age. So this is the situation actually, what is happening, what these are the points to remember, and these are the points to get questions from this lecture. Okay, so guys, let me know if you have any questions.